Welcome back to Taking Charge of My Cancer podcast. And I have a very exciting guest today. This is Deborah Epperson. She is recently a retired scientist. And Deborah worked for most of her career as a Department of Interior Biology, most recently in the U.S. Geological Survey Wetland and Aquatic Research Center in Gainesville, Florida. Prior to that, she spent 14 years working in New Orleans on protected species, marine mammals, and sea turtles, issues associated with energy developed in the Gulf of America. She obtained her bachelor's and master's from the University of Florida and her PhD from Claremont University, and her graduated work focused on upland habitats, gopher tortoise, and invasive species. Deborah is learning to embrace her new retired life. Unfortunately, part of her new life includes breast cancer. In February of this year, while on work trip in Louisiana, she got the call no one wants to get that she had breast cancer. Her cancer diagnosis was all she needed to decide to retire. It has been a journey that she's mending from a double mastectomy and embracing life to the fullness. She enjoys traveling, spending time outdoors, her horses, her dog, and anything that involves water. This includes floating the Santa Fe River, fishing, and relaxing at the beach. So, Deborah, thank you so much for being in here with me today.
Thank you. I think my dog barked on cue there. She's old, so apologies if she does that again.
No, that's all right.
Um,
No worries. It's okay. We used to all this stuff that happen when you do Zoom and then you're home and then your loved ones, including doggies, are
yeah,
around, right? So, yeah, that's
right.
totally okay. Yeah.
Thanks for having me, Dorley.
Absolutely. So can you share your breast cancer diagnosis story and how is that interact with your work as a scientist?
Yeah, I mean, so I'm fortunate to have, as a federal employee, previous federal employee, I had very good insurance, and I'm very proactive about, getting my mammography every year. So come December this year, I went for my regular screening mammogram and got the results that they wanted to do a diagnostic and an ultrasound. And I thought, oh, okay, well, I had switched providers, imaging places. So I thought, well, maybe it's just a new place. Maybe they just, wanted to take a better look because I was a new patient. And after that, then they decided that I needed to have a biopsy, which, to be honest, I have dense breasts. I spoke with my mother and my sister, and they were both like, oh, yeah, I've had a biopsy. It's nothing to worry about. And so I had a biopsy, and I didn't really give it much thought. I wasn't really thinking about cancer. And about a week after the biopsy, my GP called me while I was on a work trip in Louisiana and said, we got the results of your biopsy and you have invasive lobular carcinoma, which, was a shock to me. Because I was completely unprepared. I just sort of hadn't even considered it as an option. I don't have any family history. I'm 59. I'm healthy. It just wasn't on my radar. I just thought this was, jumping through a few extra hoops to find out I was perfectly fine with dense breasts. I think my science training came in was as soon as I got the diagnosis, the call, of course, I wanted to get home as fast as possible. My boss was very, very kind and drove me herself personally all the way back from Louisiana the very next morning. And I really just started scouring the internet for information. And I say the internet, there's a lot of information on the internet.
Yeah.
Dr. Google can be very dangerous out there.
Yes, absolutely.
I focused a lot on what I know to be reputable sources, NIH, Mayo Clinic, Komen Foundation. There's a Lobular Breast Cancer Alliance, and as a scientist, peer-reviewed literature to me is the gold standard. So I was looking at papers, and that sort of gave me a little comfort gathering information. But, I still was in shock, really, about what was happening. So that was sort of my first steps. Let's get home, let's start reading about it, and then you have follow-up appointments to have and make, which I did in very short order. So that was sort of the start of it.
I got you. So how do you arrive of the decision to have mastectomy with a flat closure?
So originally, when I first got the diagnosis, it appeared to be one small spot on my left breast, and the thinking was that I could maybe just have a lumpectomy with some radiation, and that sounded okay. I met with a surgical oncologist. Dr. Pickens was my surgeon. I met with Dr. Cheryl Hayes. She was my radiation oncologist. And Dr. Nance is my medical oncologist. I have a great team. But they requested some additional imaging. So I had an MRI. And there was another little spot on the same side, but the probability, and again, when you start thinking science, you think statistics and numbers, and the surgeon wasn't very hopeful that he could get clean margins, and the lumpectomy would be quite extensive. So then I had to think about, well, okay, a single mastectomy. Unfortunately, breast cancer is a big club, right? There's a lot of women out there that have gone through it, and I have a colleague at the University of Florida that had a single mastectomy, had another colleague at USGS that had a double mastectomy. I reached out straight away to both of these colleagues, and they were a lifeline for me, really. No matter everything you read, the science is great, but talking to people that respect, that are also scientists, which helped me, right? Other colleagues. That I know had done the same thing I had done a lot of reading, done a lot of thinking about it, getting to know the literature. So I then decided I just didn't feel comfortable with a single mastectomy. Was a D. And so I was going to be fairly lopsided, to be honest. And I did make the mistake of looking on the internet at a few images of women that were, in a similar situation post-surgery, and I didn't really like the way that looked. So I chose to have a prophylactic mastectomy on the right side. Okay. So I'm 59. Honestly, I just didn't want to have to deal with bras and boobs and any of it. It just didn't appeal to me. And I can honestly say it was the best decision for me personally. I know a lot of women have reconstruction, but I haven't looked back. I've healed nicely, and it's kind of fun to just throw a tank top on and go to the gym and not even think about it. So, I mean, for me, it was the right decision. Perfect. Yeah, I'm happy with my decision.
Great. So what factors, medical, emotionally, or lifestyle, most influenced your choice?
I think for me, I'm very active, and I have horses. I ride horses. The bra that I used to have to strap myself into just to go horseback riding was, felt like a vice on my chest. Mm-hmm. So I just felt like moving forward that the idea of not having to wear a bra and not having an underwire poke me in the chest, and it just appealed to me. From a lifestyle perspective, it seemed like a better fit. I'm married. I had a conversation with my spouse about it, and his response was, "It's your body. You do what's best for you." I support whatever decision you make, so, and then I had a few friends, that had reconstruction and had some issues, with it and were not as happy with it as they thought they would be. And one woman chose to have them removed, so it made sense for me. It's
Okay.
not for everybody. And I think if I was younger, I'm going to be 60 this year. I think if I was younger, maybe 35, I may have made a different choice. But for me, that was the best choice.
And I'm so glad that you have the support from my husband. But what I always tell my patients is you're right, it's a decision that can you only can make, right? It shouldn't be a decision based on anybody else but you. And it is important to have like respect or ask for an opinion about your husband, but it's because you just do it out of respect, right? Because it's like, yeah, here you are, and then what are your thoughts? But no matter what your thoughts are, at the end of the day, it has to be what you feel comfortable with, right?
Correct.
Sometimes I come across patients who many times are like, well, but I don't know what my husband is gonna like it or not. And it's like, I don't really care what your husband like or not. You need to really think about you, is your body, is what you feel comfortable with, and what is gonna
Right.
make you happy at the end. Because your husband may like it or not like it, but if you're not happy with it, then you're not gonna be happy at all. So it's
100%.
it's,
Yeah.
it's
I can't, I mean, everybody's different, but for me, my husband supported whatever I wanted to do.
mhm.
Um, and for me, it made the most sense.
Okay, perfect. Um, Were there any misconceptions of stereotypes about going flat that you encountered?
Honestly, I don't think so. I mean, I I don't so I have a friend that went flat and she always will not leave the house without her well, chicken cutlets we call them, or whatever you want to call, without her boobies, right? And I haven't worn them once, right? I haven't bothered. I think I've had one occasion where I the dress would have fit a little nicer had I had a little cleavage, so to speak. But um, I really don't think so. I think I just look like a big, tall, flat-chested gal now. I mean, I don't really think. I mean, if there are stereotypes, I'm not aware of them. I don't. I'm a confident person anyway,
Perfect.
but I don't really notice it. And I mean, at the end of the day, surviving breast cancer is the most important thing. Whether you have a boob or not, to me,
Yep.
is not the most important part of it, right? I want to live my life. So if this is the best path forward, I don't think anybody should question someone's choices about that.
Yeah, I loved your answer, and I'm totally okay with it. And you just really mentioned something super important. I think, how confident are you with your decisions and your body, and how happy you are when life kind of drive into you, because that's what really gonna make you move forward, right?
Right.
That's
Yeah.
super important. Um, how was your surgical experience like, and how did you recover compared what would you expected?
Um, I was a little surprised. I think that it's sort of outpatient, right? That you have the surgery and you go home. But the surgical experience was fine. I had a sentinel node biopsy to start, and I ended up having 21 nodes removed on the left side, which was a lot, right? That made that I had two drains on that side, and a drain on the right. So I think that was a little bit more invasive of a surgery. I don't think the surgeon was expecting the sentinel nodes to be involved, but they were. Luckily, the pathology after the fact, I had one of 21 nodes that were cancerous, so that's good. Um, Full disclosure, they send you home with some very good medicine, and I didn't really think I was feeling that bad until day 3, when the good medicine's gone, and you have to go to Tylenol and Advil, and then you feel a little bit more. But I found the drains to be the most sort of
Yeah.
pain in the
Right.
behind. You know, they're kind of on the sides. You can't really get comfortable. I stayed in a lazy boy chair for the first probably 10 days. Um, yeah, the drains I didn't like. And I thought I was, a big bad scientist and I could handle taking writing the data down, how much. But the first time I tried to do it myself, I got all woozy and my husband had to do it for me. So he handled the drains for me,
Okay.
which was good.
Okay. Very good. Um, when did you start PT? So you want to tell a little bit what are your
So,
five?
okay, this is how you came into my life, thankfully. I think I was about 4 weeks post surgery, and Dr. Nance referred me to you. I think my only regret is that I didn't see you before my surgery. So we sort of had a baseline. But so 4 weeks post surgery, I mean, I was very, and still am, uh, uh, I can follow instructions. I like paperwork, show me the exercises. I was crawling my fingers up the wall. When I started coming to you, I had very limited range of motion on my left side. And going to you, I think twice a week for the first few weeks. And then we went to once a week. I can't say enough good things about physical therapy. Like I said, my only regret is I wish I had done it pre surgery. So that would be my only recommendation to someone, is whether they go to the UF Breast Center or they go to North Florida or wherever they go, like see a physical therapist and get sort of examined and get some baseline information before your surgery if you have the time and have those resources available.
What do you think that was so important to do, or what do you feel like that was such a big miss point in your care?
Well, I think um, you really got in there and we helped me with a little more strenuous exercises than I was doing, right? Pushing myself. Helped with cording, which is the lymphatic system. I mean, because I had so many lymph nodes removed, I'm going to be seeing you for the next 2 years for lymphedema monitoring and surveillance. Um, I just think it just pushed me to, because I was kind of favoring this left side a little bit. And even my family noticed, and my husband noticed, like, wow, since you've been going to physical therapy, you seem like your range of motion is better. I mean, mentally, it just helped, right? Because again, the scientist in me, you probably remember, I was like, what was my angle? How much could I bend my arm when I first came? Now, how much am I doing now? And it was quantitative values that I could I could feel it and see the difference, but then there were numbers on paper that helped to
Mhm.
say, yeah, you're getting better.
Yeah.
So, and I'm not patient, so that quantified progress helped a little bit.
Yeah. And then to add to that, many times there was a paper, I was just actually talking to a student today, and there was a paper done by Nicole Stout that is a very great physical therapist who work with the APTA on the oncology section. And there was a study done where they look at patients, and if you don't do a baseline, then you can really misdiagnose early stage onset of lymphedema by a 40%, which is quite high. Just
Right,
because you don't have that baseline, how do I know that you have more swelling? Or how do I know your numbers are changing if I don't know what you look like before this lymph nodes
right,
are out, right? So definitely I agree with that. And I think sometimes as well is the education, right? Telling you what was going to happen and what things can you do and you cannot do. And then just have that assurance that I want to see you 2 weeks post-op, and let's get you in here as soon as we can so we can get you moving. And then
right, right,
you not to be afraid of move, or help you to navigate through, it's gonna be down days where it's like we got it, but we're gonna get better. Look at how much better you were doing today versus last
right.
week. And those kind of things I think is important. So
Agreed, 100%.
we will be able to help with that. Um, do you think that going flat impact your sense of body, imagine, and femininity?
Um, I think not really, though. You know, you get out of the shower and you sort of look at yourself in the mirror and you see two big lines and you sort of go, "Ooh, that's a little bit." Some days you look at it and it doesn't impact you, and other days you kind of look at it and go, "Ooh, goodness."
Mhm.
I think I probably notice it most in a swimming suit, right? Um, but they make swimsuits with, falsies, but I haven't gone that far yet. I'm just being flat in a suit. I mean, those are the kinds of uh, areas where you look around at the beach, right? And everybody looks a little bit different than you.
Mhm.
But honestly, I kind of feel like it's a little bit of a badge of honor, right? I'm on the other side. I hope, I hope it doesn't recur. I earned these scars.
Mhm.
So, you
Mhm.
know,
Mhm.
it is what it is. The alternative is not good, right?
Mhm.
Not being alive. So if this is what it takes, then this is what it takes. I'm
Okay.
okay with it.
Okay. I'm so proud of you that to look things from that perspective, right? Sometimes we hold back into, again, it's another part of the body, which is important, of course, it's part of your identity, right? In many
Right.
ways. But at the same time, you have to be looking as well at the whole picture, right? And not just
Right.
hanging on where was before and we don't have anymore versus the whole future that is ahead of the game and so many other things that are such an important part of life as well. So
Oh, for sure.
yeah, that's for sure. Do you think that knowing the scientific side of cancer affect your emotional experience as a patient?
Um, I felt like dug into the literature a lot, right? And there's a lot of new information out. You can cherry pick the literature if you want to see the sunny side or the not so sunny side. So, in some ways, I had to stop myself a little bit, right? Because as a scientist, you want to dig in and do the research. And at some point, you just have to look at the information. I mean, there's a lot of data, right? I don't know that I realized how much individualized information I was going to get about my tumors, right? My oncotype score, my genomic information, my HER2 negative or positive, hormone receptor. I mean, there's so much, I don't know that I knew all of that about breast cancer. So I learned a lot. But at some point, you kind of have to stop yourself and be like, okay, I always had a list of questions, and I still do every time I go. I had questions with you. Every time I meet with any doctor, any one of my team, I have a piece of paper written down with a list of questions I have. Anything pops I have kind of a running thing on my notes on my phone. If something pops into my head, I just, oh yeah, I want to ask about that. So, but at some point, you have to sort of get your head out of the science and just live your life, right? And so yeah, that it's a good and a bad thing, right?
Yeah. Yeah. So sometimes it's hard when you know too much and then you're like, I'm doing the right thing. How many more options do I have?
Right.
Sometimes, yeah, that can be more challenging.
And for me, right, I did not have to have radiation and I did not have to have chemotherapy, right? That is
That's major.
a wonderful, wonderful outcome, right? I just have endocrine therapy for 5 years, so hopefully I'll remain cancer free. I mean, all the data, right? If we're going to be looking at data as a scientist, all the data indicate that there's a very good probability of that. So that's what I'm going with, right? The data that I have at hand
Yes.
until I have something else, because it's easy to go down the rabbit hole of doom and gloom, and it's just not helpful
Yep.
for anybody.
So based on your scientific expertise, were there any treatment decisions you approached it differently that most patients might?
I don't know. I probably was a I probably was a little aggressive about wanting to get it taken care of, right? And even though I started with thinking I was going to have a lumpectomy, and then a single mastectomy, and then I made a decision for a double. I mean, that decision process took a few weeks, right, for me to come to that on my own, because the surgeons and are very open to breast conserving surgery. They really try to do more of that these days.
Yeah.
The days of just cutting off breasts is not really the
Over.
standard anymore.
Yep.
So, and in some ways that's good, and in other ways, I felt like as a patient, you kind of like you have to make decisions for yourself, and in some ways, I felt like I almost wanted the doctor to tell me what to do, but they give you options, and then you have to really sit with it and think about it, and that's when looking at papers and talking with colleagues that have been through it, and then coming to a decision for yourself, which is going to be completely different than the person next to you, right? So that process was helpful, and like I said, I think the only thing I would do different if I had to do it again is see you before the surgery.
Okay.
But I think a lot of times people think physical therapy, right? Physical therapy happens after something,
Exactly.
right?
Or you
But
have pain, or you have something that is bothering you, and
right.
that's what's doing it. Yep.
So, and I think I'm a little nervous about lymphedema moving forward in my life, with so many nodes removed. But so far so good.
And that is
We'll
why,
just
and that's why we monitor. And again, you mentioned it, that we have such a great program here where we actually monitor. You mentioned 2 years, but it's actually 5 years. What we do with that amount of lymph nodes, we see you through every 3 months for the first 2 years, and then once a year for 3 years, so we can actually identify early onset. Because if we identify early onset, we can reverse it completely versus way until actually something develop, and then we cannot really reverse it. So we'll keep an eye. But again, our whole point is to give you guys the education so you can identify,
right,
oh no, this is not going well. I'm feeling more swelling. I'm do what you were taught what to do, but you're still doing it and it's still not going well. Then you know to pick up the phone and then just call me versus
right,
waiting for your next 3 months or your next 6 months, right?
right. Oh
But
no, I'm very proactive. If I have a problem, I will be reaching out. And
yes,
and
absolutely.
and that was the other, I guess I would say, and it's not specific to cancer or breast cancer, but I think as a patient of whatever ailment or treatment someone may be, you really have to be your advocate. And if you can't be your own advocate, have a family member or a friend help, because you kind of have to keep after stuff. I
Yep.
mean, you could be waiting for 2 weeks for somebody to call you back. And, I don't, that passive sort of, that's not really my way. I was more like, I've got a list. I need to call
Yeah.
this, and, let's get appointments. Sitting and waiting around was not something I could do.
Yeah. And I think that's a very valuable advice as well. Sometimes you thinking that, well, I'm just have to be patient and wait here for the phone call. And that's not necessarily the case. Life gets busy, and sometimes, you were right at the amount to, like, somebody was gonna call you from the system, and then something happened and that didn't get, and then as another day goes by, and then we're still postponing more things just because another thousand things can become really priority. But yeah, that's super important. Like, the more you call, the more you're like, okay, what's happening? When it's okay to have a second opinion. It's okay to have three, four opinions. You don't have
Right.
to rush into
Right.
because perhaps you can really have a much better outcomes at the end.
Agreed.
Are there any resources, support groups, or fashion tips that you found helpful?
Well, a colleague made me some uh, crocheted little boobies, which I have not worn yet, but I will. Um, Another colleague who had a mastectomy said prints and pockets on the front are your friend. Um, I mean, I guess I would just say there's so many women that have experienced breast cancer, and you know, stick your shoulders back and be proud you're alive, because so many aren't. And you just have to be confident in your skin, whether you had reconstruction or not, or whatever. It's you're a survivor, and you're here. And that's way more important to me than, oh gosh, I don't like how this shirt fits. Well, then put another shirt on. Don't worry about it. My Both of my sisters are like, "You are so lucky. You don't have to wear a bra anymore." I'm like, "Well, I don't know about luck, but it's a silver lining for sure."
Yeah.
So
Yeah.
yeah.
How about any support groups?
I haven't really found much in Gainesville. I think my girlfriends and colleagues that have had breast cancer have been the biggest support group for me. We check in with each other, uh, texting, "Oh, I'm waiting on this, I'm waiting on that, I'm going to see, the plastic surgeon," what have you. We also try to, I had a colleague in a far off state whose sister got diagnosed with lobular carcinoma. I'm like, I'm here. If she wants to text or talk, just try to pay it forward. That's sort of what I had a friend recently, and actually, she's seeing you. I gave her my shirts before her surgery with the drain holders, and some tips that I found with clearing drains, and just sort of try to pay it forward if you can. Uh, yeah, I mean, I haven't gone to any organized groups. I'm sure there must be some, but I really haven't yet.
Okay. How about any counseling or anything like that for yourself?
I haven't really gone to any formal counseling. I've talked a lot with friends. I think being open about it, because friends and family don't really know what to say when you tell them.
Mhm.
And, you know, everybody's well intentioned, oh, oh, you have breast cancer. Well, if you're going to get cancer, that's at least not one of the bad ones. I'm thinking it doesn't feel great. I mean, people are trying to, make you feel okay, but I would just say be candid, right? Be truthful.
Mhm.
And probably 3 or 4 of my girlfriends have asked to see the scars. Like, hey, can I see? I'm like, sure. I mean, because it's just curious, right? They don't know. They don't know. So, I'm not a flasher, but hey, and they're like, well, that doesn't look, and it's kind of validating for me, because they're like, that doesn't look bad at all. I'm like, oh, that's good. I'm glad you think that, because I don't know. I see it every day, but they're like, wow, that's great. I'm like, okay. So
So I wonder why people ask that, though. What are you getting out of it, right? Just the curiosity to see what the scar looks like. I mean, if you really care for somebody because you love them, you're a true friend, like what is that? I don't understand why the question, like what that has.
it's, I think because all women, I think, have are at risk of breast cancer, right? And I think people want to know
What looks like afterwards.
kind of what it looks like. I mean, I looked at pictures on the internet before I had my mastectomy for a flat closure to see kind of what it looked like.
Okay. Yeah.
I mean, it's just curiosity, I think. What does it look like when someone's breasts are removed? I don't know.
Yeah, but I get it when you get diagnosed, right? Because you want to look, you're looking for options and you're looking what is that going to be fitting how I'm feeling. But when you don't, I just don't know. It just feels weird for somebody to just have no, except if it's like is somebody on the healthcare system or somebody's like, yes, a massage therapist, or let me look at this card to see if it's anything I can do to help you or guide you through, right? But it's looking for looking. It's like, like I'm picturing myself like, if you have like a C-section scar, is your girlfriend's gonna say, well, can I look at your C-section scar? Like, no, right? It's just
Well,
weird.
it probably doesn't. It probably, I think because I'm so open about it, they're
Okay.
like, they feel comfortable. And these are close female friends, right?
Okay.
Um, and they feel like, okay. So yeah, it's not a big deal.
Okay,
Uh,
good. But again, that
for
has been
me,
helping you, right, on your healing process from all this. So that's a good thing.
yeah, I mean, it makes me, it sort of normalizes it, if that's right. You know, it's like, yeah, I got some scars. That's it.
Okay, awesome. How did your professional skills such as critical thinking or data analysis help you navigate through the uncertainty of cancer care?
Well, I think we talked a little bit about that, digging into the literature. But, there's a certain amount of uncertainty that always persists, right? You know, uh, and at some point, I just sort of had to take the information that I had and sort of think about it in sort of not my own way of like, this is me personally, but like, if I'm looking at all the data from my tumor and everything, the the results indicate that I have a very good prognosis, right? So, and I had to sort of stop thinking about the worst case, right? What would the worst case be? And go with the actual data that I had about my particular tumor and cancer, and then just sort of stop myself and be like, okay, that's it. I've got all the information. Everything looks good. Now let's just live your life.
Mhm.
Because you can keep going, what if, and drive yourself crazy thinking the worst.
Awesome. So to wrap up, would you give a specific advice for someone who was just diagnosed with the type of breast cancer you got diagnosed?
I would say, reach out to others. If you have friends and family that have been through breast cancer, reach out to them. You might find, even when you're just talking with other friends, they then volunteer that either they had it or their sis. It's sad and surprising how many women, once you have to talk about it in that way, you realize how many people have had breast cancer.
Yeah.
um, and I would say, make sure that you feel really good and comfortable with your different doctors, your team, like your team. You're going to be, your life is literally in their hands, right? They're helping you navigate your journey, and know that, it gets better, right? It's a shock, but it gets better, and just live your life. That's all you can do, is just live your life.
And
I mean,
you're living it really fun, right? So
oh,
before
I'm having a ball. Uh, Retirement, the breast cancer diagnosis kind of pushed me to retire, and I haven't looked back. It seems kind of weird, right? All of a sudden, I went from working and to recovering from surgery, and now, traveling a lot, and visiting friends, and yeah, just having a ball.
that's awesome. That's
It's
awesome.
nice. It's
So,
nice.
yes, that's so great. And I'm so happy to hear you're doing well. Um,
Thank you.
Thank you for all your advice. I think that was great. I think that's going to be very helpful for so many of the patients out there in the audience that are looking for information. So I really
Mhm.
appreciate the time, Deb. I'm really
All
appreciate.
right. Thank you. It was good to talk to you. I'll see you in a few months, I'm sure.
Okay, perfect. Awesome. So you have a great rest of the week.
All right. Bye bye.
Okay, bye.